Well, see what happens. I mean, it's like recording. Okay, now I'm muting. Oh, here we go up there. I think I got it.
You got it?
Can you hear me?
I can hear you, yes.
There you are. Thank you.
Perfect. All is good. You never know. I wanted to join a little early.
You know, I've been in here practicing with my coworker Jane because this is new to me. Hi, Judy. Hi, Judy.
Hi, Jane.
Just like
Good
a
to see you.
Good to see you too. How have you been?
I've been good. I
guess I should make myself.
need my desktop. My desktop doesn't have video, so I just joined from a laptop. So I'm glad it's working. That's great. Hi, Judy.
Ryan, I'm Wendy. Nice to meet you.
All right. Nice to meet you as well.
We're glad it's working too, Ryan. Otherwise, I would have made you run over to my office.
All right. That would have been a fast run. Well, very good. We'll just wait about 5 minutes or so. Is that right?
Yeah, that sounds great.
Excellent.
Thank you.
Yeah.
Thanks for doing this today. We really appreciate it.
Excellent. Now, are you working, it looks like from Carly's office, is that correct? It says Carly on the...
Yes.
Okay, sounds good.
Yeah, I am. And I'll make sure that people know that I'm, in fact, not Carly. That she didn't just dye her hair. And
That's okay. Very good.
By the way, Wendy, I saw you on the Legacy Trail. I rode by you too fast. You were with your family. You were just taking a selfie. Because I got by your wife.
oh my God.
Someone said, well, why don't you come by?
Oh, that's great.
I sort of realized it after I passed you. Anyways, nice to see people out and about.
It's nice to have smoke.
Yeah, it's nice to get out.
Yeah, we'll take advantage of the skies. The air quality is impeccable right now.
It is.
We're finally blessed.
Yeah. Today's a good day.
Yeah. So, Wendy, do you want to just give a rundown real quickly of the group we're presenting to, and then a proper or about the approximate attendance there?
Yes. So the Lunch and Learn, donor Lunch and Learns are for people who contribute donations to the foundation. So we don't really know how many might hop on. I believe it was sent out to around 150 people, 130 people maybe.
Wow.
Like 24. Yeah, so in the past we've had between 20 and 25 people who attend. And what I'll do is I'll run through some housekeeping items for Zoom, introduce everybody, including myself, and then I'll manage the chat feature so that you don't have to worry about that.
Sure.
And when you're finished with your presentation, then I'll have maybe some questions from people in the audience.
Excellent. Yeah, so the foundation will be specific to Incline Village. Is that correct for IVCH or across the board? For
Yeah, across the board. So it'll be including donors from both communities.
Oh, perfect. Excellent.
Yeah.
Well, very good. Yeah, I had to write down, I have 3 pages of notes of everything that we've been through. So, well, really over this last year, a lot of it's been taken off of our strategic plan that we had outlined for this year and kind of where we were with the goals met, and had a little bit of a detour along the way with COVID, but then shortly, after a couple months, got back into it. So give a
right
view of, sounds like that's what you'd like to hear, the donors would like to hear, kind of our current operations, where we are right now and where we have been and what we've done given COVID and everything. Is that correct?
Are you going to talk about how to improve your health a little bit, exercises while you're sitting?
Yep. Absolutely.
How much?
Yeah. We have that on there. Just let me know how much time you'd like me allotted.
I don't have much time. I don't know what the time frame.
Okay. Yeah, if you can see.
So the Lunch and Learn lasts about.
So what we're going to talk about is the forward head position. and just give a quick overview of that, because all of us are looking down
Yeah.
and our heads
Thank
are
you.
facing forward. And so really just keep it simple with just some little tips that people can do there.
All right.
So that sounds good. How you doing, Harry?
Sounds great.
Doing great. Hey, Ryan.
Good. Good, thank you. Thanks for having me.
Sierra Valley doing okay for you?
It is now. Yeah, I mean, we were inundated with the smoke from the Claremont and Bear fires, of course. Just really depends on the way the wind blows, but we had a brief scare yesterday. They reported a fire going over Little Truckee Summit to Jackson Meadows, and now it's, they put that one out, it sounds like fairly quickly, so yeah.
I like the cooler weather. It's
Well-
getting a little bit cooler.
It does feel nice. Absolutely.
My house got down to 63 last night, which was good.
Yeah, natural air conditioning.
So I trapped it all. Save it for when I get home.
That's it.
I see Fred and Rick and Alicia, Jonathan. It's nice to see you all.
Fred's
Oh,
got
okay.
a beautiful
So I am
backdrop
keep-
there.
We'll just give it a few more minutes and let a few more people hop on before we get started. Yeah. We'll give it about 1 more minute before we get started.
I wonder where that backdrop picture that Fred has is from.
That looks like
Beautiful.
Squaw Valley.
That's squaw. I was just gonna say, yeah. That's before, I don't know if that's, Fred, if that's before I don't see the hotel to the left. I don't know how old that picture is.
You can build that fence on any ground, rocky soil too. So when you can't drive a fence post in, you can always build a fence like that.
Oh, there you go. Oh, I guess it's still standing.
Did you have those in Texas, Harry?
Most places we could get a post in the ground, but I always come up with backup methods, something like that. Either a zigzag or a A-frame. A zigzag works good too.
Mm-hmm. Okay, so I think maybe we'll go ahead and get started. I'd like to introduce myself briefly. I'm Wendy Lenz. I'm the Donor Relations Coordinator for the Tahoe Forest Health System Foundation. I'm standing in temporarily for our fearless leader, Carly Epstein, the director. She is on maternity leave, so no news yet, but resting, hopefully getting a little bit of time with her feet on top of the couch. So welcome to our donor lunch and learn. We're really happy to have you here. Just a few housekeeping items for Zoom. I muted everybody upon entry just to reduce some of that feedback that happens when we're all not muted at the same time. We will be using the chat feature if you want it at the end of the presentation. If you have any questions for Ryan, you can use that. Feel free to use the chat feature, and I will make sure that we direct those questions to him. Let's see. So today we have with us Harry Weiss, CEO of Tahoe Forest Health System, and Judy Newland, COO and Administrator of Incline Village Community Hospital, and Ryan Solberg, who is the Regional Director of Therapy Operations for Tahoe Forest Health System. So thanks everybody for being here. And just a few words before we get started. Please know how much we value your support and your partnership, especially during, these last 6 months when it's been a little extra challenging for the health system to navigate through COVID-19. We really appreciate your support and your partnership. So the structure of today's Lunch and Learn will give the leadership an opportunity to briefly update and give some overview of the health system and how we're doing, followed by about a 20-minute presentation from Ryan. And at the end of that, we will open the chat feature and get to your questions so we can answer any questions you may have. So with that, we'd like to welcome Harry Weiss, CEO of Tahoe Forest Health System.
Good afternoon, everyone, and thank you for your interest and your partnering with us. You're a very important part of our healthcare team as we, connect with our community. And healthcare is truly a people business, and so we really view you as really critical partners for us. All of the efforts that we're focused on every waking moment is really how we can serve our patients better. It's really not about us, but our focus is always on our patients, and we've been about a very significant journey for improvements that will never end, but it is a significant journey just in the last 5.5 years as we've been just focusing how can we protect the health and well-being of our communities better. And just to give you one little statistic that's an interim outcome, we had about 47,000 physician-related office visits at June 30, 15, and now as a health system, we're well over 100,000 a year pace right now. And again, that's not about us, but it was just trying to put key providers in place that are meeting unmet needs of our residents in our community, and especially those residents that are full-time individuals here. And of course, we'll take care of part-time guests as well. But so that kind of change is really profound on an organization. It affects our master plan, which is at least a 10-year master plan, probably north of $200 million there, and a new entity that we created so that we have a team that can actually serve our community is a workforce housing joint powers agency where we've partnered with the school district, we've partnered with the public utility, the airport district, and so forth, because as you've seen how real estate has heated up, being able to recruit and retain a quality workforce is hard for any employer, and we're a great employer in this area, but it's still really challenging. So it's exciting to be working really hard every day on what are those unmet mental health and physical health needs in our community, and our list is still long of things that we need to work on and provide solutions for. So that's what we enjoy doing every day is, taking care of our community and trying to solve gaps. And it's our pleasure to do that with you. So that's my brief introductory comments, and we're doing well so far with COVID. It's been a little bit slow for us. I think we've had about 177 admissions. related to COVID, and 177 individuals went home in much better health than they did when they came. And really just proud of our healthcare team and how they've continued to improve their skill with that disease category, and of course the other diseases that they treat as well. So I'll close it down at that.
Thank you so much, Harry. And now we will move to Judy Newland. She's the COO and Administrator of Incline Village Community Hospital.
Thank you all. I really appreciate you taking your time out of your day to join us and listen to Ryan today on what he's going to be presenting. But what I would like to do, I usually try to give just a little bit of an update on pandemic. I know people hear about it every day in the national news, but wanted to let you know kind of regionally what your health system is doing in that arena. So again, we are just preparing if there is going to be a surge in the fall and the winter. So we're just doing that anticipation. I do want you all to know that for Tahoe Forest Hospital, I don't believe we have not had a positive COVID patient. I think our last date was August 25th. We discharged somebody, or August 23rd, and Incline has not admitted any. So I did want everybody to know that. And I think we've all seen that we've sort of stabilized on that and seen the numbers coming down. But we do want to make sure that we are prepared if for any reason we have a surge this winter. So for Incline Village Community Hospital, we will continue with our Monday through Friday drive-by clinic. That will not change. It's, I think, 1:30 to 3:30 in the afternoon. We are doing something a little different there, though, for the flu shot. That ad will be coming out hopefully within the next week or two. We will be providing drive-by flu shots at that clinic, I think on Tuesdays and Thursdays between 10:30 and 12:30. So that'll make it easier for the community. I do know the local pharmacies also provide flu shots. For Tahoe Forest Hospital, we'll continue with our adult drive-by respiratory COVID clinic. We are expanding the bays there. I think we have 2, we're gonna add a 3rd. And we are actually adding a pediatric walk-in clinic. It's hard to see really small kids in a car, so we are anticipating opening that around the 1st of November for our, pediatric clients, students that may go to school that need to be seen instead of going in where other well children are at. And then we're expanding to Tahoe City for a few months during the winter. We want to make sure we serve that community also, and so we have an urgent care over there. And we are going to provide what we call a drive-by walk outdoor, a couple hours a day too, where we can go ahead and provide exams for those patients and do swabbing. One of the really good things that we've been able to accomplish is really expanding our testing capabilities in our health system. Part of that has been through pre-planning and then donations. So we have what's called the Abbott ID testing. That's what we call a point of care. It's a rapid test. It takes an hour to perform. We do that for now all of our patients, no matter where they come and they're symptomatic, our ERs, our drive-bys, we do provide that test. We are going to expand locations for that. So we have that at Tahoe Forest Hospital Lab, but we're actually going to put it where we do the adult drive-by and the pediatric clinic in Truckee. So we just do it right there. We'll be able to call the patients back that same day. And we do it at Incline. And then when we open our clinic drive-through at Tahoe City, we will also have the Abbott ID there. So really just trying to expand our testing. The other thing is we will have in place by the middle of October what we call our BioFire, and we were able to purchase that lab equipment for both Incline Village and Tahoe Forest thanks to donations from both foundations. And what that allows us to do is actually equipment that our physicians have wanted for a while. Was a bit expensive, so the donations help buy it. It provides testing for a lot of respiratory illnesses along with COVID. And that takes about 2 hours to get results on that. So that will be a tremendous asset to our community. So I just wanted everyone to be aware of that. We've also been speaking with our school districts, both at Incline and Tahoe Truckee, along with our ski industry, personnel about their opening. The ski industry, I think, bring 4,500 employees to the area, 5,000. So we want to make sure that working with the counties and them, that we have what they need in order to serve the new employees along with their clients and the school district. And then lastly, two last things. For all of you, one of the treatments based on patient signs and symptoms that are admitted to the hospital, one of the primary treatments is the medication remdesivir. Tahoe Forest Hospital now has 10 courses that we have in the hospital there, which is great news. We did not have that up to 3 weeks ago. We had none. And so we had to either transfer patients or try to get them from other hospitals, which was very challenging. So luckily, Nevada County Public Health, the state of California, opened up the opportunity for smaller hospitals that don't have the volume necessarily that we were given, being able to purchase then the remdesivir, have opened that up. And so we were able to attend 10 courses. So that is great news for anybody that gets admitted to Tahoe Forest Hospital. And then lastly, I can't speak a lot about the COVID vaccine. I will say for the state of Nevada, they have reached out to all hospitals and they have requested that Incline Village Community Hospital be a dispensing hospital when those become available. So we did put on our application at Incline, and based on when the vaccine's available and based on priority, Incline will be a dispensing site. We are working with our counties and the state of California on their process, but most certainly, you know, we will be at Tahoe Forest Hospital wanting to provide that vaccine when it becomes available. So I just wanted to give a heads up on those items. Thank you, Wendy.
Oh, thank you, Judy. That was a lot of valuable information. I know we all want to stay updated on COVID protocol and what's happening. So at this point, we'll turn it over to Ryan Solberg. He's the Regional Director of Therapy Services, and he'll be discussing physical therapy services in 2020 and beyond. So welcome, Ryan. Thank you for joining us.
Yeah, thank you very much for having me. I really appreciate the opportunity to be able to speak. And you know, Carly is out, but she invited me to this. So I want to thank the foundation, Harry, Judy, Wendy, for helping orchestrate this and being part of it, and the foundation for all your support for the hospital. So just to bring you up to speed, so my name is Ryan Solberg. I'm the Director of Therapy Operations here at Tahoe Forest Hospital. For those of you who may know, I'm also a treating therapist in the outpatient arena, but we cover all service lines for Tahoe Forest Hospital, covering everything from home health services, our inpatient program, inpatient therapy. We provide services for the ECC. We have a wound therapy department, and we have 3 outpatient clinics in which we serve all different disciplines. We have physical therapy, occupational therapy, and speech therapy. And one nice, it's amazing, and I get really choked up sometimes when I talk about the team, because the team on our group is absolutely incredible. We have such a diverse wealth of team members who have come from different arenas. Some have been with the district for over 20 years here, servicing this community, and have expanded their service lines and have seen their professional growth over years. And just along the line of the continued growth of our service line, we've brought in some new people who've been a wealth of great specialties that we've added. And like Harry mentioned, is keeping up with the service lines for the community and adding new providers to this community. We've really tried to respond to that need over these, especially these last few years. We've seen increased growth in our communities of North Shore, Incline, and Truckee, and seeing these specialty providers and the expansion of the multi-specialty group providers is really trying to respond to what those needs are. We have for instance, Dr. Weinstein that joined our group, and we responded with bringing on more specialty providers in pelvic floor and women's health. And then we had more focus on the total joint program with our ortho physicians and really expanding our service line and what the needs were for trying to get patients navigated through that system pretty quickly. So we're really proud of the program that we've put together there. We've really seen an expansion over the last couple of years too in pediatrics. And so we've really tried to respond to that need of our pediatric services in the community. So really, if, you know, with this presentation today, I wanted to just go through, and I really wanted to go through the strategic plan that we had set forth for this year for 2020 and bring everybody up to speed with our goals and kind of where we currently were in the beginning of January. And then obviously we had a little bit of a setback given in mid-March, and really what the return to normal looked like for us as a group in therapy. So as everyone knows, you know, we came through and COVID really kind of hit the main operations here in mid-March. We went down to more of a tier 3 to tier 4 level where we were really seeing just more post-op patients that had a critical need for therapy. So we try to navigate and get those patients seen and really take care of those individuals and do our best by the community to protect them and staff as well. So things were fairly limited, you know, for March and April. And we slowly started the return back to normal in late May, early June. And, you know, with the return to normal, everything looked a little bit different. And I should backtrack a little bit. Back in mid-March, we had to figure out a way to service those individuals that previously we were in full operation. So there was a little bit of a gap, and we had to figure out how are we going to offer service. And that's where telemedicine came out. And what would that look like with therapy? You know, can we actually provide therapy services with telemedicine, and what does that look like? It's been talked about for years, but as the emergency declaration came out, it provided really an opportunity for us to do this with patients. And so we did launch that, I think within 2 to 3 weeks of COVID operations occurring system-wide. We had telemedicine launched, and we had upwards of 40 to 60% of our visits were with telemedicine. And that's really what majority of our visits were at that point. So it was quite interesting, and we had to get all our computers and our technology set up that way. But I can tell you it worked really well, and our therapists got very creative with how they delivered therapy, how we even did an evaluation with telemedicine. So there was a lot of interaction with the community during that time, and you know, we were able to successfully do that. When it came into June, we ended up going and returning back to in-person services, and we ended up going up around 70% of our normal volume for the month of June, and then returned back, added about a 10% increase for each month. In July, we saw our volumes go up to about 80% of our normal operation. August was about 90% of our normal operation. And now, you know, we're trying to, you know, really return back to normal as much as we can. But obviously there's, you know, certain restrictions that we have, but we've had a great opportunity, and we work hand in hand with our registration department, our scheduling department, all of our therapists. We have all the facilities set up for the appropriate distancing, the actual screening process that employees come in through all the clinics, as well as our patients. That is really the new change of what you would see. Other than that, it's really system. All operations are fairly normal after that. We are in level 1 PPE minus gloves. We wear gloves when it's appropriate, but you'll see us in face shields and masks, and we're given a new mask per CDC guideline, and it's what our hospitals directed us. And they've done a phenomenal job with the communication on a weekly basis. Oftentimes, you know, we're getting communication, you know, up to 3 times, 4 times with the daily huddles on just how we're going to best navigate this course. And I think that's where I can applaud the administration and how well they've done for the communication, and for us to really have a clear pathway on something that really wasn't so clear to begin with. Nobody's been through this. So I'm proud to say, we've done a really good job. Our therapists have been understanding, our patients have been understanding, and I feel that we're offering a great service and returning back to normal. So that being said, we had a pretty robust strategic plan for 2020, and we had a little setback in those few months, but I feel that we're kind of returned back to that. We can really focus on those goals that we had for this year. One of the biggest goals that we had was really expanding different service lines for the providers that have been added. Number one is the capacity. We're seeing an increase in sheer number of individuals in the community and that are living here full time. So how are we going to navigate patients in quickly into our service lines and be able to improve access to care, improve the navigation, improve the experience, and be top notch in every category? And really what it boils down to is improving our communication and making sure we're having excellent communication with our scheduling team, our authorization team, and with our clinicians, and making sure that we're getting patients seen quickly into our facilities. So we work on that, and that's kind of on the background that a lot of individuals may not see up front, but there is a lot of effort on a daily basis to huddle, and we group together and we look at what was successful in a given day, what maybe wasn't as successful, and then we try to fine tune it a little bit better each day. So there's a lot of background to make sure that your experience is excellent. With that being said, we're proud to say that we've added some new individuals to the team to really expand for instance, our pediatric service line. We added a dedicated speech therapist to pediatric program. We have a dedicated occupational therapist to the pediatrics. We have a dedicated physical therapist, as well as we're looking at an additional one for that pediatric program. A lot of the school services were not able to reach those students during that time with COVID and throughout the summer months. So we did see that expanded need for it. We try to respond to that need and be able to fit those individuals in. So we've worked really hard with that. Our total joint program is something that is an incredible program that Tahoe Forest should be incredibly proud with. Regarding that program, we have everything over the last few years. We've launched the whole experience of the total joint program has involved creating a total joint handbook for the patients to get early on, and to launch a total joint camp that anyone that's upcoming in that total joint, total knee, a total shoulder, or a total hip replacement attends that camp, and they're put on twice a month by Kathy Avis with the orthopedics department. They're then put into a pre-op physical therapy appointment to review what is pending for that upcoming surgery. So we outline everything that they'll go through from the experience, from that acute stay in the hospital to making sure that they know how to use the walker, that they're safe using the walker, and then the progression to a cane, they know how to get up out of bed. So really that improved and lowered some of that anxiety that those individuals may have going into surgery. We wanted to make sure that it was very clean up front and they had great knowledge going into it. We then coordinated some orthopedic meetings where we had the whole team together and talked about just all those different touch points along the way of a patient experience, and really trying to improve that process. Getting them seen quickly on a post-op day 10. We make sure that appointment is established, and there is no lag in care. So that just has taken a lot of careful coordination, but we're really proud to say that's a great program that we have here. And I would entrust anyone to get their surgery here. My parents, I refer everybody to this program because it's that much better, I feel, than other facilities. So expanding our goal is to expand OT and PT service for behavioral health. We're looking at expanding. We have a new OT on board. She's actually not new with us. She's been an inpatient before, but she's going to start working over in the outpatient arena. and really focus on behavioral health and for outpatient services. So we're really excited about those services coming on board. We do know that mental health is a critical need in the community at this point, as well as in, nationally. I think that everyone is focused on that. So we're really looking at how do we integrate some different community-based programs and work reintegration, community reintegration for individuals that are suffering with mental health. So we're excited about that, and this will be developing over the next couple months. With Dr. Muero, she's our neurology specialist here on board. It's been incredible growth there. We've seen increased referrals from Dr. Muero, and largely in part, she's so good and she's such a believer in therapy, and she's so collaborative in her efforts and what she wants out with her patient care. It's phenomenal. And so we're putting together a spine specialty group that will combine Dr. Winans, Dr. Muero, and Dr. Stanek here, and really to expand and coordinate those referring providers and really learn from each other. They can learn from us as practitioners, clinicians, and we can also learn from them and help collaborate on patient care items. Same thing with the Parkinson's support group. We launched that over this last year over an Incline. Unfortunately, our therapist is out on maternity leave, but we're excited to get her back in late October, in which we'll hopefully be able to resume some of those Parkinson's support group in a different way. We can't have in person at this point, but we are excited about having that, her return. So we've had an incredible growth this last year, and I'm keeping track of time here. With our athletic training program. And so we've coordinated with our athletic trainers, in which we have now 3 ATCs on board, with all hired out of our orthopedic department. We have MOUs with all the school districts of TTUSD and Washoe County. There are ATC services that are provided, and they are hired through our orthopedic program. We coordinate, and we've launched baseline testing at every high school. So every athlete at that high school, North Tahoe, Truckee High, and Washoe County, goes through a peer objective baseline screen of how they are functioning, their strength, their mobility, the biomechanical patterns. What we're trying to do is get and really screen athletes from that are going into the sport and prevent injuries and provide education. So the part of that screen is to get a baseline screen of that athlete. So if they were to ever get injured, we would have something that we could go back on and say, this is where you were, let's return you back to your normal, and this was your normal. But then we can also provide education. Out of that, we found that there was a significant number of potential ACL injuries that were there. And with that, we launched a injury prevention program dedicated on ACL injury prevention with female soccer players, in coordination with Dr. Winans and our athletic trainers, and Anna Aldridge, who's our main ATC hired out of ortho. She's the lead. So that being said, we took that program and the baseline screen, and now we're incorporating that into what we're doing with Squaw Valley. So we had a MOU that we signed last year with Squaw Valley. We're working with their athletes, and we're really, the focus is injury prevention. So we have an ATC that's there half day a week and in season, and the ATC is providing services for those athletes that are part of the ski team program. This year, we're really excited about the potential growth. Some areas that we're looking at, and this will be scheduled. The intent was to do this in spring of last year, but that got a little detour there. But we're going to launch the same baseline screen that we'll launch with the Squaw Valley ski team athletes. So that will be in probably the next couple months that we'll schedule that. And along with the concussion testing that we coordinate with Dr. Winans and the ATCs. So all those athletes, we're really proud to say this is something that is really taking the service lines that we have at our hospital and packaging them up and saying, what, everyone can actually be treated like an Olympic athlete. And that's what our intent is, to really provide the best baseline screen, the best injury prevention education, and to make sure that we can put a healthier group of kids out there and prevent them from getting, a possible low back injury or an ACL injury. So, and that is an area that we're really excited about, the continued growth there. We continue to offer services for our different employer groups. So we, not many people may know that, but we have different contracts with employer groups in the area, town of Truckee, with different ski resorts, and we provide pre-placement screens, return to work screens, and some of those areas that are work healthy programs like North Star Launch, and we have a contract with them in which we provide athletic consults for any and all of their employees that would like to have an injury prevention consult. That's part of the program. So it's a great opportunity for us to be able to do some employer-based services. So that's kind of another service line that we incorporate in here at the clinic. So hope to continue to expand that. Many of these employer groups are large and they're self-insured, so they're trying to be proactive with what they're doing for their employees to keep them healthier and not have them get injured on the job, decrease the workers' comp claims. So between our wellness department, which is run by Wendy Buchanan, and occupational health, we're really trying to coordinate those teams together to provide the best service for those employers. We call those industrial athletes. It's a big area that is a focus right now too. So how to make those industrial athletes less prone for repetitive injuries in their specific job. So next area is the potential. So we've had some recent expansions. Sorry for the delay there. Expansion of Tahoe City. So we're proud to say Tahoe City was probably in need of an expansion for quite some time. We knew that. And I know that there was, some time, it took some careful planning to make sure that it was done well and within budget, but we expanded Tahoe City. The remodel has been complete. It was completed in spring of last year. And we added 3 additional private rooms. And there's also a dedicated wellness space, which has been reallocated. It's essentially going to be a shared space. Mostly it's all therapy focused out of that wellness, but wellness services will be launching some of their services in coordination with our therapy line. So we're really, really proud to say that North Shore and Tahoe City it's a phenomenal clinic. It feels a lot like a cabin, and it's such a great group of individuals that have been in Tahoe City for quite some time. So again, all the service lines that we are providing here in Truckee at our main, call it mothership, we're trying to provide at all of our satellite clinics, Incline and Tahoe City. We want them in that community to have the same service lines as we have here. So that's where you'll see that we launched the added speech therapy in Incline. And we have OT, PT at both of the clinics. We hope down the road to launch speech therapy in Tahoe City as well with that expansion. So really excited about that part as well. So wound therapy, for those of you who've known about the wound therapy service line, it used to be located in the hospital. That was a service line that we quickly got out of the hospital. It was a high-risk population, and we found that we could use put those patients over here at our center, the Center for Health and Sports Performance, where our Truckee operation is, and really come up with a long-term plan. So this was a lot of coordination with Judy Newland, making multiple visits here, and with our engineering team, and quickly coming up with a solution, which was phenomenal, of making a dedicated space that will be for the people. And I can tell you that the patients love it. The patient experience is excellent. Our therapists love it. And so that now is taking place over at our Truckee Center for Health and Sports Performance. So that is essentially, we'll call that a relocation, expansion, improvement of service line with that area there. So the other area that we're expanding in different service lines, you'll see little niches here and there. And a lot of this is us dedicating our professional development and really giving back to our employees that want to develop professionally in different niches. So really you're going to see the expansion and a lot of dedication on our part to really promote them and have them go towards their specialty. There are individuals that would like to pursue pain management certification, more of a orthopedic specialty. So the beauty of our team is that we have the ability to cross-refer within the clinics, within the team. And, if I'm not the best person that may be able to help you, there's going to be somebody on our team that's just as good. If not, they are the ones that you should see. So there's just a really great cross-network referral that we have, and we work in tandem with each other, trying to do what's best for the patient and really giving that patient the best opportunity for success in meeting their goals. So I believe that that covers it. There's a big list for 2021 that I haven't really promoted yet to my direct report, Scott Baker and Judy Newland, but that will be coming. So thank you very much for.
Thank you so much, Ryan. Go ahead, I'm sorry.
Oh, no, thank you. I'm open if there are any questions that you may have. I'm happy to answer them. Or
I have a question.
yes.
Can you give us a tip on how to manage our lives doing Zoom, sitting correctly?
Absolutely. So that was built into this presentation. So why don't we go ahead and work on that. So we were just going to do a few tips. Number one is everything that we are doing these days involves a computer and looking down. And this is something that as a society, we're doing more of. We knew that even before. We're working on laptops is also different than working on a desktop. Desktops are usually set up and you can set them up more appropriately, that they're actually higher up at the appropriate eye level. With laptops, generally we're looking down and our hands are forward and our elbows will tend to come forward. So what I'd like everybody to do, I'm actually going to do like a little side view. If you can take a look here. And this is actually where my desktop is. So my desktop is set up so I actually have the top of the screen, which is right there at my eye level. That is the key if you're working on desktop. The other thing is you'll see here, my keyboard is established. So my elbows should be at a 90-degree angle here and my wrists are neutral. That's an important area that we need to focus on so we're not hyperextending our wrist when we're at a keyboard. So regardless if you're on a laptop or a desktop, is to make sure it's wrist neutral and your wrist is slightly below your elbow versus up in here. Now there are a lot of people too that may use a desktop here as their writing surface. So their keyboard ends up going and gets moved further forward and they may use this area to write. That would entail and that would result in my elbow coming forward and reaching too much. And immediately the minute your elbow leaves your body, these muscles become hyperactive and you can develop a lot of myofascial pain and upper trapezius muscle spasms here just by the pure nature of holding your elbows away from your body. So it's really important that we keep, sorry for the scale on this, keep our elbows a little bit tighter to the body and our wrists slightly down and neutral. And if we're using the keyboard, the same is true here and we're not reaching. The minute we reach, that's when we see development of upper trapezius spasms. Now the next topic is the forward head and we call it chin poke posture. So the loss of, of sense of where my head is in relation to my shoulder. So if you want to think about proper posture, without your grandmother here nagging at you or your mother. My dad's a physical therapist. My mom's an ER nurse. So they would just simply correct me and slap my back when I was a kid, but simply ear over shoulder and right over the acromion. And so really that's what we'd like to see established. And the more we tend to look forward, our eyes will fatigue. As our eyes fatigue, our head will try to focus further forward. Our head then drifts away from our shoulders. And now we have this poking forward position of our head. So one simple tip that everybody can do is really think about more of drawing this chin tucked back, and the action almost creates somewhat of what appears to be a double chin, but it's more of a lift up from the top of your head upwards and a retraction. So if I look at my chin and forehead, they should be nice, a good vertical relationship here. And that should immediately draw your ear over your shoulder. And regardless of the position, you want to think about maintaining that at the computer and avoiding this position here. So a simple tip that you can do throughout the day, I like to do these little computer posture exercises, is simply get your hands behind the back of your head and you push your head back into your hand and you perform a chin tuck. And so it's an isometric exercise, and you repeat hold for 5 seconds, and then you should feel a little shake, tightness here. That helps strengthen up. This is really equivalent to our abdominal muscle of our neck. Just like the abdominal muscles help prevent low back pain, these are my abdominals of my neck, and they get lost. A lot of times they get over lengthened because our head is drifting forward. So these become long, these muscles become short and too tight. You can end up in a lot of headache, individuals that present with headaches and myofascial tension. So just simply doing this will lengthen here and tighten here and realign the muscles. The next is what's going on in my shoulder blades. They get static and stuck in a position where we're rounded. Muscles get tight in the chest. These muscles in the back become weak and lengthened. That results in a little hyperkyphosis, meaning a little curvature. So just taking your blades back and setting your shoulder blades into your back pocket is a key thing to think about throughout the day. And one simple way to kind of get that area moving is taking your hands here and then pinching your shoulder blade together, raising your arms up. And as you do that, you're extending through your mid back here. And it just gets a little blood flow. It decreases that static posture that you may be in a position for hours and hours. So I would say focus on ergonomics, your position, whether it's laptop or desktop. Where's my head in relation to my shoulders? Where are my shoulders and related to my hips? So we want everything stacked up in a nice, perfect line. And if anybody would like to have additional resources, I can share my email. I'm happy to email you. I have great handouts. I have great exercises. I'm happy to do that and provide a little short, 5 exercises. It would come through our home exercise program portal is MedBridge, and would send you a link and you can download, get those exercises and watch the videos. So if that's helpful, I'm happy to share that with you. So,
Thank you.
And if any of you would like those resources, feel free to email me and I will forward that to you from Ryan.
all right.
Okay, Ryan, I did have a question from someone in the audience. Currently, what percentage of patient visits are via telemedicine? And also for student athletes, is baseline functioning for concussions included?
Yeah, that's a great question. So number one, for telemedicine right now, it's fairly limited. We have approximately, I would say about 3% to 5% are via telemedicine. Some weeks it's a little bit, kind of hovers in that single digits, but it's fairly low. It is something that we are keeping in the background. We use a portal. It's a HIPAA compliant portal called Better PT, and it's actually specific for therapy groups, but they do have a platform, for general practitioners as well. But it is something, potentially we're keeping in our back pocket down the road if it's anything that we need to implement at any time. But it has allowed us also an opportunity to reach those patients if they tend to go, if they're on vacation, if they'd like a check-in. So integrating into those different appointments. But really the focus right now is in person. So the second part of that with baseline screening is the concussion testing is specific with the Squaw Valley MOU. We do the concussion testing. The concussion testing is part of Dr. Winan's program that she has with the concussion program. And I believe the way it works is with certain groups, whether it's soccer and football, they are at certain ages and they implement the concussion testing, the impact test that's done, and it's done via a computer program. At certain ages, it may be for the freshman, sophomore, if it's they're entering athletes, and then potentially the junior year. And I believe the way it works is with the physical years, which is the incoming freshmen and the juniors. So I may need to provide a little clarification on that, and I can get that. Was that, I think, Alicia Barr that asked that?
Oh, no, actually it was not. It was another one of our participants, Fred.
Okay, sorry, I saw Alicia response there, but it'd be great to get a little bit of clarification from Dr. Winans on that, because she's the one that runs that program, and it's kind of runs not in lieu as part of their therapy baseline, but it runs outside as part of her service line that she does.
Mm-hmm. Okay, great. Are there any other questions for Ryan? I do have a thank you for Ryan. Great presentation. You are a fine speaker. Excellent exercises on the computer. So thank you for that. And I do also have a question for Judy at this time. Let me get back up here on my chat. Please spell out the name of the new test for respiratory viruses that gets results in 2 hours. And also, what access does our hospital have for convalescent COVID plasma?
So the respiratory test is specific to the BioFire piece of equipment. It's called Respiratory Panel 2.1. The 0.1 is the COVID part of it. So I think it was 2.0 prior to that. And I'm not, I don't know all of the respiratory panels that are inside of that. So I respond if you let me know later who sent that. I can have more detail if they want more detail. Related to the convalescent plasma, that is, so we have been in a study, actually, I think through our relationship with Stanford, when it first came out to provide the convalescent COVID plasma. We are no longer in the study because actually there's no regulation that we can't do it now. So we do have access to that. There is out of Reno. I think that our ability to get that on site is probably within an hour. So we do provide that services. We have given it to some patients when we had COVID positive patients. So we do have that available.
Excellent.
Thanks.
Any other questions for our panel today? I think we're good then. Thank you all so much for joining us. We really appreciate it. And again, thank you for your support. Very meaningful. And we'll see you at the next lunch and learn. Thank you, Ryan.
Thank you. Bye-bye.
Thank you, Ryan.
Bye.
Thank you.